Hi guys, my name is Dr. Sisnett and I want to thank you for tuning into my YouTube channel. Today we're going to talk about some of the most commonly asked questions under my TikTok, Instagram, and Facebook posts. Now, some of the questions come almost as a way to try to find out why is it I only target people who are overweight. Well, for one, most of the issues that plague people who are of the sub-Saharan African or of sub-Saharan African descent, most of them are as a result of lifestyle choices, whether it be the foods we eat, our habitus being overweight, or just our habits in terms of smoking. So it's obvious that I would target that audience. One of the main issues that plagues our community, people who are overweight, and people who are overweight tend to be diabetic and hypertensive as well. 85 to 95% of people who are diabetic are overweight, and 75% of people who are hypertensive, they're overweight as well. So I have to target the majority. So to answer one of the main questions I get all the time, how can people who are slim but still have diabetes and hypertension, how can they reverse their diabetes and lower their blood pressure? It's the same process. You have to exercise, you have to diet, you have to watch what you eat, and you have to be compliant with the medication, compliant with your doctor's visits. There's no getting around it. You have to adopt the mentality that your health is very important for you to end up living a long and productive life. There's no getting around it. So number two, one of the other questions that people ask me, why should we trust doctors? You should trust doctors to do what's right by you. Now, I'm not saying that all doctors do this, but I'm saying the majority do. There's nothing wrong with shopping around to find the right doctor for you. There would have been people that would have come to me, might have said, okay, he treats me well, but we don't have a connection, so they go and try another doctor. That's just how you have to look for your doctor. Your doctor has to be open to talking to you. Your doctor has to be open to having a dialogue with you about what's going on with you. You have to shop around for a doctor and stick with that doctor. And that's just how you have to go about your health. You can't just take one brush and paint all doctors with that brush. It's not fair. So I'll give an example of what happened under one of my posts this week. I posted a video and I stated that the information being dispensed in that video was basically creating a space for people to come and realize that, or think that they cannot trust doctors, when in true fact you can. Under my posts, people posted of their experiences with doctors. I'll tell you what the post was. The post was a person stating that when they go to a doctor and they get their blood pressure checked, that if it's high, the doctor automatically slaps medication on them, and then the person under the video posted some herbs or some foods that were healthy, like beetroot and those kinds of things that can just lower their blood pressure. What that person was describing was white coat syndrome or white coat hypertension. So the average layman is going to look at that post and say, well, okay, I don't have to go to the doctor. Let me just take some of these things and keep my pressure low. I can't tell you how many people have presented to the doctor's office or the hospital because they've never gone to a doctor, and they presented when they have had a serious complication of a condition that if they were controlled, they could have prevented themselves from developing a complication. So I posted it and I explained what the person was describing, and people posted underneath stating that they have had that experience. So that's where the dialogue comes in. So I came in and I said, well, you know, I'm sorry that that's the experience that you had, but ideally, if you went to a doctor and your blood pressure was elevated, for instance, if it was 139 on 79 or 80, doctor really shouldn't start you on medication just like that. Now, if you went to the doctor and it was 200 on 120, yes, they would start you on hypertensive medication because there's something obviously going on, and they would have given you blood tests. So that's the dialogue that needs to be had with patients. Another thing that I have realized too is that sometimes there are instances where patients are there looking at you. I guess they appear to be listening to you, but they're not listening at all. And this is an experience that I've had where I sat and I had a full conversation with a patient. I told them exactly what needed to be done to better their health. And something happened and a complication developed. Now, the tests, they were given to the patient. The blood tests, the investigations, medication given to the patient. The patient did not take the medication. The patient did not do the investigations. And the patient returned worse than when they first came. But what did you think was the first thing that patient stated? First, the patient stated that the doctor never told me this. Again, this creates an environment where people listening now would think that the doctor did something wrong. It's not always the doctor's fault. Sometimes people just don't listen. I've worked, or should I say, shadowed dentists, and I've seen dentists sit down and explain to patients what they should do after an extraction, what they should do to keep their teeth from developing cavities. Patients sit down, watch them, appear to listen, and then return 2 years later with complications. Or in the case of an extraction, return the day after, well, maybe 2-3 days afterwards with complications of, an extraction, because they just went back to their regular scheduled program as opposed to following what was advised by the doctor. So trust in your doctors and your dentists. If you don't trust your doctor and dentist, you need to look for a new one, because that's a big part of ensuring that your health is optimized. And not every single story you hear about a doctor or dentist is correct. And believe that the majority of us, when it comes to doctors, dentists, nurses, we actually want you to get better. So this whole distrust of us, it has to stop, especially in the African or Afro-Caribbean community. We have a great distrust for healthcare workers. And I really wish that would change, because then we could be a healthier population. So number 3, are herbs better than pharmaceutical medications? That's a question that I get a lot underneath my posts. This is a question that you have to kind of look at it from a broader view. Steve Jobs, I heard a doctor speak about this on TikTok. He got diagnosed with pancreatic cancer. And the doctor on TikTok, he himself mentioned this case, was diagnosed with pancreatic cancer that could have been cured with surgery. Steve Jobs, one of the wealthiest men on the planet, chose to use traditional medicine. Did not work. And then he went back later on when the cancer had progressed to get the surgery, but by then it was too late and he passed away. Now, a man with all of those resources, don't you think he would have had access to as many herbs and traditional medicines that would have helped him to beat this? This is why everything has to be taken with research. A man should not just be able to walk up to you and say, try this dandelion and this will cure your cancer. I have had the experience where someone had operable head and neck cancer, operable. Their sister said to them, try this herb. And they tried the herb for maybe 6 months and kept coming to clinic. And when they returned, after they realized it was progressing, it was too late. Now, to me, it looked as though the person's sister might have thought it would have worked, but essentially she assisted the rapid demise of her brother. This happens. There's nothing wrong with trying herbs, but speak to your physician about what you want to try. That's all I ask. I can't tell you which is better, because some drugs are made from medicines or from nature, and as such, I can't really tell you which one is better, but I can tell you this. A discussion with your doctor is very important. So thanks for tuning into this first episode, and there will be more. And I